comes in and they're really experiencing a lot of pain, and you look at them and you diagnose that they need a root canal, which we hear those, oh yes, I've had to have a root canal. But what does that actually mean? What is a root canal?
Well, that's a good question. A lot of people have that question. I think to understand a root canal, you kind of have to understand the anatomy of a tooth. A tooth has, in its center, is living tissue. The tooth is very much alive. So there's nerves, there's blood vessels, and in the chamber of the tooth and down each root is a canal. So that's where we get a root canal. In that canal is where the tissue lives, and a root canal is simply the removal of that tissue. So we create a hole in the center of the tooth, the top of the tooth, and remove that tissue. We use files to go down each root and clean that out. We sterilize the tooth so that there's no more bacteria in there, because a lot of times the tooth was infected. And then we seal it off with a sealer material that allows us to maintain that tooth.
So now you said maintain the tooth, which is actually why we're going to all this trouble, because the easiest route would be, let's just yank that thing out. Why is it so important to keep our own teeth?
Well, yeah, I think in some people's perspective, yanking the tooth would be easier, but it's always more challenging, and it's more expensive in the long run to try and replace a tooth that's now missing. So if we can maintain that tooth, and if we can do that for as long as possible, that's really ideal. Our tooth, nothing is going to be, we can't replace the tooth that God gave you. I mean, there's just not quite a replacement for it yet. There's good attempts, and we're doing a lot better with implants and things like that. But if we can maintain that tooth, really your function, everything is just better if we can maintain that for as long as we can.
Now, going back many years, I can only imagine, well, I suppose in the old days they would just have pulled everything. And even nowadays, the thought of having a root canal is going to put some people right off, because it sounds awful, it sounds painful. Not so.
You know, I think the misconception of a painful root canal maybe started back then, but really, when someone has a toothache, that consumes them. They can't sleep. And so what do? They come in and they get a root canal. And I think in their memory, that's what they associate, the root canal with the toothache. But not really. It's a pretty simple procedure. We numb you up like we would do a filling. It may take a little bit longer. It's kind of an intricate, a lengthy procedure. But really it should be, for the most part, pain-free. Very rarely do we have a tooth that we have a hard time getting numb that is just not pain-free when we do a root canal. So I think that's a little bit of a misconception. And
well, with all dentistry, I hate to say it, but people think, oh, it's going to hurt or it's going to be uncomfortable. Not these days.
No, it's not too bad. No. And I think it's kind of guilty by association of the toothache. Really, the root canal is what gets you out of the pain, so eventually.
Puts an end to it. So tell us who we need to call if we're having this, and it is an all-consuming pain, isn't it, when you have it? So actually, to me, it wouldn't matter what happened as the end result, because you're getting rid of the pain. Where do we need to call?
You can give us a call, 753-4400. It's Aspen Dental.
Come in and see them if you're having that ghastly pain. They will sort you out. Thanks, Dr. White.